So you're asking about misinformation. I guess one thing about the level of information, sometimes the level of information in the group can be incredibly high. I mean, these guys are sort of hearing about what's happening in centers of the city. They're really connected with sort of what's going on. At the same time, there is a risk, and then sort of I see it with anybody who talks to another patient, he might say, you should do such and such and such and such, and and it's sort of like what fits for me doesn't necessarily fit for you. So there is the potential risk of misinformation, and I always sort of wonder about that when I send men there. Are they gonna, is this gonna happen? And I don't see the effects of that misinformation. If it is there, I think men seem to know how to deal with that and just kind of, okay, I'll move on to find something else that gives me better information. I just don't see the downside. I think as a group, they're self-aware enough to know, the value of the information and the limits of the information that they can provide.
Some of the drugs that we use for erection enhancement, so for example, the Viagra, Levitra, Stax, and Cialis, they maybe have taken it without reading the directions on how it should be taken. And, when you're having this conversation with somebody and giving them back that knowledge, you see, their facial expression, or perhaps in the comments that they make, that they had no idea that there is actually a way in which to take these medicines. So I find that, again, when I'm asked to attend to prostate cancer support groups and give information, I feel that I'm again giving back to them by giving them the accurate, up-to-date information that they need to have in order to give these potential treatment options a chance.
Well, I mean, there is going to be misinformation because the field is changing. Vitamin E, not that many years ago, was thought to be a great chemopreventive agent, and the SELECT study was done, and it turns out vitamin E is not very good. In fact, it could be detrimental. Same with selenium. So the science is changing. The misinformation, if you will, I'm not sure that's the right term, the information itself changes over time. So the groups have to keep up the best that they can. There are a lot of, I hate to use the word, but I will, quacks out there, especially on the internet, who are offering all kinds of alternatives. I think that has to be filtered through a support group. I think it comes down to the leadership of those support groups to make sure that that information is filtered appropriately. If there's a question, invite a healthcare provider, a scientist, someone who has an expertise in the field to come and talk to the group.